HPV is the most common sexually transmitted infection (STI). HPV is a different virus than HIV and HSV, herpes. 79 million Americans, most in their late teens and early 20s, are infected with HPV. There are many different types of HPV. Some types can cause health problems including genital warts and cancers. But there are vaccines that can stop these health problems from happening. How is HPV spread? You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. It is most commonly spread during vaginal or anal sex. HPV can be passed even when an infected person has no signs or symptoms. Anyone who is sexually active can get HPV even if you have had sex with only one person. You also can develop symptoms years after you have sex with someone who is infected. This makes it hard to know when you first became infected. Does HPV cause health problems? In most cases, HPV goes away on its own and does not cause any health problems. But when HPV does not go away, it can cause health problems like genital warts and cancer. Genital warts usually appear as a small bump or group of bumps in the genital area. They can be small or large, raised or flat, or shaped like a cauliflower. A healthcare provider can usually diagnose warts by looking at the genital area. Does HPV cause cancer? HPV can cause cervical and other cancers including cancer of the vulva, vagina, penis, or anus. It can also cause cancer in the back of the throat, including the base of the tongue and tonsils, called oropharyngeal cancer. Cancer often takes years, even decades, to develop after a person gets HPV. The types of HPV that can cause genital warts are not the same as the types of HPV that can cause cancers. There is no way to know which people who have HPV will develop cancer or other health problems. People with weak immune systems, including those with HIV/AIDS, may be less able to fight off HPV. They may also be more likely to develop health problems from HPV. How can I avoid HPV and the health problems it can cause? You can do several things to lower your chances of getting HPV. Get vaccinated. The HPV vaccine is safe and effective. It can protect against diseases including cancers caused by HPV when given in the recommended age groups. See who should get vaccinated below. CDC recommends HPV vaccination at age 11 or 12 years or can start at age 9 years and for everyone through age 26 years, if not vaccinated already. Get screened for cervical cancer. Routine screening for women aged 21 to 65 years old can prevent cervical cancer. Who should get vaccinated? HPV vaccination is recommended at age 11 or 12 years or can start at age 9 years and for everyone through age 26 years, if not vaccinated already. Vaccination is not recommended for everyone older than age 26 years. However, some adults age 27 through 45 years who are not already vaccinated may decide to get the HPV vaccine after speaking with their healthcare provider about their risk for new HPV infections and the possible benefits of vaccination. HPV vaccination in this age range provides less benefit. Most sexually active adults have already been exposed to HPV, although not necessarily all of the HPV types targeted by vaccination. At any age, having a new sex partner is a risk factor for getting a new HPV infection. People who are already in a long-term, mutually monogamous relationship are not likely to get a new HPV infection. Symptoms. HPV may not cause symptoms at once, but they can appear years later. Some types can lead to warts, while others can cause cancer. Warts. Common symptoms of some types of HPV are warts, especially genital warts. Genital warts may appear as a small bump, cluster of bumps, or stem-like protrusions. They commonly affect the vulva in women, or possibly the cervix, and the penis or scrotum in men. They may also appear around the anus and in the groin. They can range in size and appearance and be large, small, flat, or cauliflower-shaped, and may be white or flesh tone. Other warts associated with HPV include common warts, plantar, and flat warts. Common warts, rough, raised bumps most commonly found on the hands, fingers, and elbows. Plantar warts, described as hard, grainy growths on the feet, they most commonly appear on the heels or balls of the feet. Flat warts generally affect children, adolescents, and young adults. They appear as flat-topped, slightly raised lesions that are darker than normal skin color and are most commonly found on the face, neck, or areas that have been scratched. Cancer. Other types of HPV can increase the risk of developing cancer. These cancers include cancer of the cervix, vulva, vagina, penis, anus, and oropharynx, or the base of the tongue and tonsils. It may take years or decades for cancer to develop. Causes. HPV is a virus that is passed skin to skin through sexual intercourse or other forms of skin-to-skin contact of the genitals. While most HPV infections are benign, causing warts on areas of the body including the hands, feet, and genitals, there are certain strains that put a person at a higher risk of developing certain types of cancers. HPV can infect anyone who is sexually active. Many times, infected individuals are asymptomatic, meaning they display no symptoms of the virus. Although most HPV infections resolve themselves, sometimes, they can remain dormant and later infect a new or existing sexual partner. HPV can be transmitted to the infant during birth. This can cause a genital or respiratory system infection. It is important to note that the strains of HPV that cause warts are different from the group of HPV strains that cause cancer. Prevention. Measures that can reduce the risk of contracting HPV include having the HPV vaccine, practicing safe sex, practicing abstinence or being in a monogamous sexual relationship, not having sex while there are visible genital warts. It is hard to prevent common warts. If a wart is present, people should avoid picking it or biting fingernails. For plantar warts, it is recommended that shoes or sandals be worn in public areas such as pools and locker rooms. However, keep in mind that research into many of these areas is far from conclusive. If you are thinking about using an herbal medicine, first get information on it from reliable sources. Make sure to tell your healthcare provider about any herbal medicines you are taking. If you enjoy the video, please share with your friends. And subscribe to the channel for more natural medical tips.